everyone, I'm Lisa. We're back, and this time we're going to just go quickly over a special topic in blood vessels, and that is the concept of the aneurysm. So I'm actually, we're going to go back through this, but I just wanted to show you what an aneurysm kind of is and looks like. So an aneurysm has a couple stages to it. The first I want to talk about is, so here is one that's coming off the aorta. So if your heart was up here, aorta comes off and is like feeding blood, among other places, but like feeding blood down to the lower part of the body. Okay. This blood's under a decent amount of pressure. In some blood vessels, normal, healthy blood vessels, this is what we would normally see, right? We would see a regular shape, but what we see here, and regular size, but what we see here is this kind of distension, right? We actually see in a couple of places right here as well. So, this is technically the aneurysm proper. And so like what an aneurysm is it's a blood vessel that's gotten thin in an area due to usually some type of damage. In this case, atherosclerosis, which means when folks have part of the lining or the lumen, the epithelial tissue of a blood vessel actually die due to the fact that there's just like, you know, thick animal fat usually slathered on it, and it can't breathe anymore, right? So this is the hardening of the arteries. Um, what happens is this part of the blood vessel is going to die off, right? And so a few things are going to happen. One of the things that can happen is that, as you know, there's necrotizing areas right in here, part of it like rips off, or it somehow allows blood to seep in between the tunica intima, remember the most inner layer, and some of the other layers, which could either be the media or externa. Usually the media obviously would be the first one because it's like literally the next thing next to it, intima. Externa, right? And so as blood is seeping into these areas, it's actually filling these areas. And so a couple things are happening. Number one, we're getting this destabilized structure, right? And this blood is filling in. But then the second thing that's really important is all of these tissues here that are normally thicker, right? They're supporting the shape and the integrity of the blood vessel. They're getting close to rupture, right? And so rupture is kind of like the second component of the aneurysm. It's a very dangerous component. If it does rupture, then we have internal bleeding. Oh, it's like, yeah, internal bleeding is imminent if they do rupture, and it's very difficult to control that bleeding. And it can be a very dangerous situation. So again, matters what your patients are doing. Lifestyle is a large factor in this. There are some, of course, inherited disorders or medications, stuff like that, that can have a propensity, meaning they can lead to aneurysms developing, but it's not always, like we say, imminent. Okay, so let me go back to the bullet point list. All right, so things to think about. It's a weak point due to thinning and damage in an artery or sometimes the heart wall. Usually we're looking in arteries. Aneurysms in the brain, aneurysms, aortal aneurysms, like just really lots of places. It forms a very thin-walled sac, right? So that's that point where we've broken past tunica intima and we're starting to like leak into either media or externa. The thing that's really dangerous is as the heart beats, it pulsates with every heartbeat, and that can lead to rupture at any time, especially as it's continuing to thin. Dissecting aneurysm is when the blood is accumulating between the tunics, or those layers we've been talking about, of the artery, and it actually physically separates them to a large degree. Again, the stabilizing, like thicker, muscular tunica media, that's the one that we really see the degeneration within. Most common sites in the abdomen from the aorta, right? Just coming right off of the heart. In the kidney area, so renal arteries, and then also aneurysms in the brain, so at the circle base of the brain. as well. So it can cause a lot of pain by pressure, causing pressure on other structures as that bulge kind of expands. Some aneurysms, they are completely undetected and they just hit by surprise. Um, when they break finally, they rupture and that causes that hemorrhage, which is often internal, very dangerous stuff. Many things can cause it again. We talked about inherited disorders like congenital weakness of blood vessels, uh, different types of lifestyle disorders, also bacterial infections, especially bloodborne ones. And interestingly enough, when trauma, right? So post car accident, for example, or um, there's just like a handful of other external factors that could cause that type of physical trauma, violence, actually shock waves, and some other things that can go into that. But the by far most common is going to be atherosclerosis and hypertension, and that is usually a lifestyle. Oops, sorry. Right, so these are diets that are high in animal fats. And don't get me wrong, my favorite flavor is bacon. So, but I'm just saying, I throttle that. Um, Hypertension, obviously, as well. So like high pressure, high blood pressure, kind of forcing those walls open and then really like expanding on any kind of damage within the blood vessel walls. Okay, right. Okay, so that is aneurysm, and I'm glad we went over it briefly. And yeah, that's pretty good. All right, well, if you have any questions, please feel free to email me and have a happy day. Bye-bye. Hi everybody, it's Elisa. I'm back, and so this time we're going to be talking about some receptors actually that are very key to regulation and homeostasis in the body. So they are the baroreceptors and the chemoreceptors, specifically of those found in the vasculature, because it's the blood vessel chapter. Okay, and just to kind of clarify, I had somebody ask what vasculature is. So the vasculature is the architecture of the vessels in the body, where they are, where they're going, are they big, are they little, what are they doing there? Yep. All right. So let's go ahead and get started. So, what's important to understand is within the blood vessel walls, specifically, we're going to look at arterial, there are sensory organs. And so these sensory organs are going to sense pressure and chemicals, right? So, the pressure ones are the baroreceptors. And then, sorry, maybe wants to join my iPhone hotspot. There you go. And the second is chemo. Also, that's easy, right? So these sensory structures are found in the walls of like the larger or the major vessels. They monitor things like pressure, right? So the baroreceptors are going to do that. And then the chemistry of the blood at the point. So those are the chemoreceptors. What they do is they actually use that information to regulate the heart rate. And they do it by expanding or contracting the blood vessel diameter. And they also can have effects on respiration as well. So the carotid sinuses are going to be baroreceptors. So just as you can imagine, carotid is going to be near the internal wall of the carotid artery, right? So this is an artery that goes through neck and head. So this one specifically is monitoring the blood pressure, and it's going to transmit signals. There are the glossopharyngeal nerve, right? So glossopharyngeal nerve is going to actually kind of just sense um, kind of the pressure as a baroreceptor, how high of a pressure is the blood that's coming straight off of the aorta in the heart, right? Because carotid artery comes right off of it. Oh my gosh, I'm so sorry I yawned, you guys. Oh, somebody needs some coffee, and that person is me. Anyway, so it allows for this thing called like the baro, you guessed it, reflex. And so this can be an important thing to, we will talk about this in just a little bit, especially as it pertains to things like, histamine type, like antihistamines. Okay. So within the carotid artery, you have the carotid bodies that are also the chemoreceptors. They're interesting because they're little like ovals actually near some of the common carotids. So they're going to monitor the chemistry of the blood, and specifically, they're looking at respiratory rate indicators, so things like CO2, O2, all that good stuff. So they're also going to use the glossopharyngeal nerve to kind of talk to the brain, especially when it comes to, do we need to speed up or do we need to maybe slow down respiration rates? Okay. So again, these are chemoreceptors. So there's 1 to 3 bodies in the aortic arch. And so if you remember, the aortic arch does like this, and then there's 1, 2. It's in a nutshell, right? So this is like what the aortic arch is. Um, it is up here at the top, just coming off of the heart itself. Okay, right. Oh, yes, and it's going to be innervated by vagus nerve, right? Vagus, baby. So Big Ten is going to be what kind of regulates the heart rate. And for the most part, it actually tells the heart to slow down. It says you're beating a little too fast, guys. So, right. Here's what it looks like. As you can imagine, so here's aortic arch right here, right? And here's our 3 branch points. Okay. Barrow or pressure receptors are right here because this is actually the highest pressure of any of the vessels in the entire body. So it's like a really good way to sense it, especially for the heart. Carotid sinus, as you can see here, is like a bigger opening area. That's gonna have the baroreceptor. Oh my gosh, is that 2 yawns? Oh my goodness, you guys. Is that 2 cups of coffee I gotta get now? Oh, I think it might be. Um, right. And so that's where you would find them. They're actually kind of like just this area. They're not like organs like dissectable, like large scale organs like kidneys or brains or, anything like that. They're actually kind of like modified patches, if that makes sense. Okay. All right, I think that's pretty much it. So other things I wanted to talk about. So the baroreceptor reflex. Let's talk about that just really quickly. So the baroreceptor reflex is what causes changes to overall blood pressure. So one of the things that we know are certain drugs impact this quite a bit. Drugs like alcohol, of course, drugs, illegal drugs, legal drugs, but especially in children. I think it's like the commercial name is Benadryl. It's an antihistamine, and so Benadryl can act in younger children who are still developing their baroreceptor reflex because you are not born 100% developed. Oh, you poor things. If you have kids that are too young, this actually can affect their baroreceptor reflex so negatively that they can cause overall heart failure. So that's one of the reasons why Benadryl really has kind of, unless it's an emergency, you really don't want to give it to kids under certain ages. And I think, that age restriction has actually gone up quite a bit. I don't know where it is right now, but I know that it is slightly kind of creeping to older and older ages for that reason. Okay, and that's it. So those are some ways that blood pressure is stabilized outside of the heart. Things that are used are primarily going to be control over the arterial width, right? So if we need higher pressure, we're going to make that inner lumen smaller. If we need like lower pressure, one of the things that we can do is we can actually make the lumen larger for lower, right? And then higher, right? Okay, and I think that's kind of really it for now. All right, so I'm going to get those cups of coffee. And I, in the meantime, hope you are having a wonderful morning. Okay, bye-bye.